Welcome, everyone, to this discussion on public sector's communication conundrums and how to support staff deliver effective services and improve lives whilst overcoming technology silos. I'm Mark Blanchard. I'm the Public Sector Director for GovNews, and today I'm delighted to be speaking with Sam Pittman-Smith, the Director of Transformation at Norfolk County Council. Sam, great to have you with us.
Thank you. It's great to be here.
So, Sam, I believe you have a wide ranging career focused on delivering organisation and transformational change in the public sector, as well as that in private sector and charity and voluntary organisations, and have led multiple large-scale business and service transformation programs, including that of managing mergers and acquisitions, business case solution development, through to practical implementation and delivering benefits to frontline services. I'm interested in hearing more from you today, specifically, I suppose, on your role as an expert on new service design and setup, and how you look at policy implementation and improving organizational efficiency and effectiveness, but also about looking at how you take a person-centered approach to transformation and how that then enables you to create and implement strategy, design, and delivery with, I'm sure, an amazing team alongside you to deliver innovation and ultimately improve performance. So, yeah, great to have you with us. And I suppose to put some context around this series of conversations we've been having this year, GovNews partnered with RingCentral, who are a specialist in communication and collaboration solutions in the public sector. And we surveyed 500 participants across the public sector space, over half of which was C-suite and director and senior management level. Roughly, I think it was over 35% specifically in local gov from that 500 pool of responses. But this whole series of talks has been to examine some of the insights and opinions and real world experiences that have come out of that research. And today, the focus is very much on how transformation can deliver more efficient workflows and processes. So I'm going to start with the fact that 97% of all those survey responders said that their main operating system was Microsoft. The other 3% was Google. In local government, it was 100%. But how do you feel that the Microsoft Teams 365 enhances public sector productivity and collaboration? And maybe can you share some specific experiences?
Yeah, I mean, it's interesting because I came before this role from digital transformation consultancy. So it was all Google Hangouts and Slack. So Teams didn't really feature unless we had public sector clients. So coming into the public sector and local government and finding it is Teams, that is the tool that you have, has been a really interesting transition. But I think, one of the reflections I have is having joined the organization during the pandemic. This was my experience of actually joining the organization. I only saw the people on the screen in front of me. I didn't have a building to access. And that shift, that culture change, it was really significant for us as an organization, and I think for many public sector organizations. And it took us to a point where people who would have, I think, really resisted going on to that sort of Teams calls and messaging made that shift because they had to. And we are never going to go back to where we were. So pre-pandemic, a lot of the meetings were face-to-face meetings, and it was required, it was demanded that there were face-to-face meetings. And particularly amongst our social care colleagues, that's particularly some of the aspect of where that face-to-face draw came from. So people would spend hours travelling in and across the county, and Norfolk's a large county, so it takes quite a lot of time to travel to meetings wherever they might be. But now, if you walk around our office, and we have people back in the office as most people do, but it's not full time, and you will walk through that office and you'll see social care colleagues, and they're on Teams meetings. They're actually sitting at their desk in those meetings, having those conversations. It's become part of how we work. So we are saving on that travel time. It does mean it's more easy to meet people that otherwise you'd have had to spend hours on a train to get there, or you just wouldn't have been able to justify that kind of input. So what we're seeing is it's really supporting much more collaboration between organizations. And for my team in particular, one of the things that we're doing is we're talking to the Productivity Institute, for example. And so we're able to have that conversation, a series of meetings, and look at setting up a piece of work together, because we
Yeah.
can, because it's not, we don't have to justify that cost to the organisation of that. But you also have it in the social care context, where working across the boundaries across NHS and social care becomes much more straightforward, because you're meeting in that collaborative space online through Teams. So we're
Yeah.
seeing that, and we're also beginning to see the inclusion of parents, for example, or carers in conversation. So it just eases that collaboration, because you don't have to take 3 hours out of your day to get to a place and do a meeting and then the chat afterwards. You've got the ability to be able to say, actually, I need to be here for this particular activity. Now I'm going to actually step into this meeting, and I can do it because I only have to just sit down at a desk, put my headphones on, and off I go.
Mm. Have you found any increase in things like Teams fatigue with your workforce? Is that something that's become a problem? You're saying that your workforce are invited to come back into the office, but no doubt you've changed that workspace to
Mm.
allow for more collaboration. They're not necessarily coming back to a desk. They can work in different
Mm.
hubs. But I know in public sector specifically, tackling that Teams fatigue has been quite an issue. How have you combated that?
So there's a couple of different things we do. So the guidance we put out is to say, be in the most appropriate place for the task, the job you need to do. So you don't have to be in the office, you don't have to be at home, or you don't have to be elsewhere. It's where you're most appropriate. So we have fire service, so they do have to be in a specific location. That we don't have a choice about that. But for those colleagues that can have a choice, then we make that choice. So what we found for some of us, and myself included, is because we're quite busy, you end up with back-to-back Teams meetings all day, and that can be a real challenge, a real difficulty for people in terms of being able to actually stretch your legs and have the comfort break that you need. So
Yeah,
what we're doing is we've said, we are deliberately trying to get people to finish meetings earlier, to have the 5-minute break between. That's a very conscious decision. It's part of what we're having a conversation about within the organization. We're encouraging that. It doesn't always happen, but we are encouraging that. And we're also trying to think consciously about the social aspect for people, which is how we start to combat some of that Teams fatigue. Because and it seems to be, the surveys show that it's particularly for younger people that being isolated at home is not working well for everybody. So we
yeah,
were very consciously asking people to think about those social aspects of work, and so that we're deliberately saying, well, these meetings will be in the office, these will be face-to-face meetings, so that we get that healthy mix. And for
yeah,
me, the it's an interesting one around collaboration, because where I get the opportunity to do a collaboration around a physical whiteboard, I really enjoy that. I find there's real energy in that. So, but we do have the great tools to collaborate online. So for me, it's about, you're looking at the right tool for the right activity. And where it's a really, one of the things that my team offer out to the organisation is workshops that help people find their way through complexity. So we've got a project within our children's services, and they are in test and learn phase at the moment, and it's associated with a DFE, Department for Education, piece of work, and it's looking at how do we intervene early for children that are missing school,
mm,
and how do we stop that escalating into a worse situation, and what are the things that we need to know. So they're in test and learn with bringing the data together. And what they were talking, and there was huge enthusiasm amongst their children's services colleagues about where this could go and what this could do. And so one of the things that we offer is that if you need to find your way through a complex set of issues and to find out, to make good decisions, we offer these workshops. Now, that for me is a face-to-face, because you're putting things on whiteboards and you're moving things around, and to then shape the options, the decisions, next steps, and that's easier. But for many other things, the online collaboration just does work better. So it's about the right tool for the right situation, and having a blended approach. And I think you have to have a blended approach, otherwise you do just end up sitting in a getting backache.
Yeah. So, how have you managed to integrate workflows with all the different departments across the council or other stakeholders in order to enhance service delivery?
So one of the things that we are doing very consciously is we have what some people call corporate services or enabling services or support services, whichever you want to talk about. That's our digital services, our procurement, our HR, my area, and my people. And what we're doing is using a Teams channel to be able to have a conversation about there's a piece of work coming up. So it could be quite big and significant for the organization. So anyone who's part of the group and that represents the whole organization can say, I've heard this thing, or this piece of work is coming through. We think it's going to be big. So it could be social care reform, can be one of those things that we talk about reasonably regularly. And this is a piece of work. We're starting to bring this forward, and what we're doing there is saying, well, actually, it's the responsibility of all of us to keep an eye on that and actually bid in to the work to say, actually, we do need to be involved in that, because and that's a team around task approach. So making sure that we don't get sort of 6 months down the line and someone within one of our services says, well, now we need some HR support, or now we need some digital service support, or now we need some insight and analytics support. And then those in the enabling services, well, you didn't tell us. How are we meant to know? We don't have that resource readily available for you. And that's a really big piece of work. And then you end up with a kind of crunch point because you end up delaying that piece of work, or you have to let something else slip in order to be able to support that activity. So it's starting to really bring us together as an organization more so than we have been, because we've not been bad at it, but it's actually improving, using the tools to help us improve how we work and operate, and to be able to really get round things early. Because we know, and I know this from my past experience because I was a gateway reviewer for central government, is it's in the early stages of shaping a piece of work that you can have most influence over the later success or not of it. So that's one of the really active things that we are doing as an organization, to have that approach that really supports our children's, adults, community environmental services type pieces of work where there's something big coming and we need to get around it as an organization.
Mm. Big part of the survey we asked was around the role of emerging technology, specifically AI, and how that was going to help organizations communicate, collaborate smarter, more efficient
Mm.
as an organization, but also how that was going to improve citizen experiences and engagement. How is emerging technology such as AI offering new and exciting and different ways to approach service delivery?
And this is one of the areas that I think there's so much opportunity, and it's something that we are actively pursuing. So one of the pieces of work that we're pursuing within the organisation is a falls prevention pilot within our adult services. So what's that say? What we're doing there, and again, we're in test and learn and pilot, so we want to go about this with the right caution, but also we see the opportunity. So what we're doing in that space is there's been long held programs of looking at prevention in adult services, but it's usually focused around the people we already know about and the people who are already engaged with us, and that then gives us a limit on the reach into those that are at risk of things like fall. So prevention, there's been many discussions about the definition of that term, but this is actually looking at a more proactive end. So before people get in touch with us, how can we actually help them out with some small interventions that may prevent a fall? Because we know that there's a real deterioration for people in their health and well-being once they've had that fall, and it often causes lots of complications. So now we are working with district colleagues and looking at district data as well as our own data to say who are the people who are at risk, and then we're actually contacting them and offering preventative services and interventions for them to access and pick up to stop that whole cycle for them and keep them healthier and well and at home as long as possible. So that's AI driven in terms of mining that data and the risk factors.
Do you inform the citizens as to how you've come up with that kind of analytical conclusion that it was driven by AI, or are they just happy that you're taking that proactive approach to actually say, look, this could be a concern and we want to prevent it should it happen?
Yeah, we have put some comms out on it to say this is what we're doing. It's something that we want to be open about what we're doing and how we're doing it, but also to reassure people that the human still exists in the process,
In the
because
link, yeah.
because the call is made by a human being
Yeah.
out to the people who've been identified as at risk, and that's where the service offer happens.
So, in what ways do you think technology will help the public sector be more person-centered in their approach to transformation and service delivery, and why is that important?
So I think it has tremendous power because of the ability to analyze a lot of data and to pull out insights from it. It helps us free up capacity to be more person centered. And for me, that whole point of, it has to be person centered. And I think if we drive it from a person centered perspective, we're going to be more efficient and effective anyway. That's the whole point around user-centered design, is actually you design out some of the flaws in the delivery. And it is one of those areas where I think we've quite often thought about design of our services around what's easy for us to deliver. We haven't always thought about, well, how is it to receive? And there's efficiencies and effectiveness that we can get by that in using technology and using the user-centered design to integrate our services better. So we look at what happens at the point of delivery rather than what are we doing and how are we pushing it out there. And it also, if we are user-centered and we're looking at the information we can provide on our internet site, for example, if we can design that around the people who are going to read it and access it and think about, well, what is it they really need to know and how do they engage with that information, we are far more likely for them to access the things that we want them to be able to access, whether they're preventative services or information, or whether it's services that we need to provide for them to help them to be well. You look at the average reading age, I think for Norfolk is 9. So how are we helping people access the information and being able to see what we have to offer? And I think it also then comes back to the bit that I think is the challenge that I set before us, which is, do we really make use of the technology that's available to us? Because if we think about, most people will have a phone. A lot of people have a phone, and you think about the complex interaction they have with that device. People's digital skills are quite sophisticated when it comes to their private life and their personal life and how they interact with social media, etc. And I think there's real opportunities for us as public sector to do more in that space in terms of how we engage with our citizens and how we engage with those out there who we want to communicate with, but also hear back from, because we all have an obligation to consult on things. Have we really thought about how we use technology to do that better and in a more engaging way?
Yeah. So within the survey, we looked at, I suppose the transition public sector organisations are going from in terms of things like RPA through to, adopting AI and machine learning. Are the machines taking over? And is it going to result in a devaluing of a human in the process?
That's a really good question. So I don't think they are, because it is up to us as human beings to decide how we use the technology available to us. So for me, it's all about how do we make sure as we engage with the technology that we are keeping the person and the person's need at the center of this, and looking at, well, what is the intention behind this? What's the outcome we're after? And what's the best way to achieve that? And making sure, and we're really conscious of this as an organization, how do we make sure that the person comes in at the right point? How do we keep that decision making where it should be, so that it isn't the faceless bot? I always talk about the bad bot experience, where those experiences when you're going online and you're asking a question, you're just getting a nonsense response. And I'm afraid I get quite frustrated on those, and there'll be various conversations that organisations will have from me which aren't
Yeah.
necessarily
And
great.
it doesn't matter how you've called the bot Steve or whatever name you've given the bot,
Yeah,
and the fact that you're
yeah.
communicating to the citizen that this is a bot and it has limitations. But yeah,
And then
I
that then ties back to being person centered isn't just about I've listened to you and I understand what you need, what your pain points are with a particular service delivery I'm looking at. So I've resolved those as I've designed the new thing for you. But I'm also listening to the feedback you provide me with. I'm also looking at the opportunities to improve things for the staff who are delivering the services as well. So I think that's the other element to this, is we keep the people at the center of how we design what we do and how we
mm.
understand whether it's actually being successful or not.
So I'm conscious we're coming to the end of this fascinating talk. What I'd like to ask is what currently excites you in terms of the transformation opportunities that the tech
Mm.
is providing, and reflecting on that, I suppose, from your experiences in local government, but perhaps across the public sector as well.
I'm really excited about not just things like AI, but the combination of the technology that's available to us and what it can help us do. Because I see the opportunity to take some of the mundane activities out of our working lives. And it's been a promise for a long time of technology, but I actually see we've got the technology that is more capable of doing that, which is why we're so interested in doing test and learns, and to make sure that we're trying these things out and proving value and allowing for failure and allowing for us to then succeed because we've learned from that failure. So I think it's that mundane, but I see, with some of the specifics around AI, you've got that ability to get value out of that kind of long narrative text and free text fields that we couldn't previously, and
Mm,
get insight from that and turn that into something that helps us act better and make better decisions. And that's the bit where I'm really interested in how we utilize that and use the power of the information to join people up and have the right conversations with the right intelligence behind it, to then make better decisions, faster decisions, so that we can intervene sooner to improve the lives of the people who are on the receiving end. I mean, I've got a really nice example of one of the things that we've done recently, which I really like, and it comes out of the work of our innovation team that sits within my area. And we've set up, and it's based on what we did, a piece of work we did during the pandemic. But what we've done is we've set up a virtual care agency, and we have set that up for adults, and it is for those needs where you have someone needs to have a check on whether they've taken their medication, whether they've had a drink, whether they've eaten breakfast. And so we're doing that in a virtual sense rather than someone having to drive all the way out to find out whether someone is up and about, whether they've done all those things. This is now done via a tablet. It's the
mm,
virtual care agency. So that then frees up the time of people for people who need physical help to get out of bed and get dressed. They can actually have that, because the people who don't need that physical activity, they just need some human interaction, that's in place. And that for me is just a lovely example of taking the technology and doing something really interesting with it that gives people the support they need without it being intrusive, but also gives them the human contact as well.
mm. How much did legacy tech and the lack of integrations based on the legacy systems that you need, which have the data in, how much did that stop you moving at pace, or have you managed to find the cure to those issues?
I think, what we've done is we've focused on the areas where we can move at pace. And so,
Mm,
you've got to look at what can you do now? How can you prove the concept? How can you show something working, so that it then starts to break down the barriers to people wanting to share the data, because it has been a long conversation across social care and NHS organisations and district councils. But we're really seeing that once people see what it can do, they're more willing to then want to share their information because they see the opportunity. I mean, that was true of the Falls pilots. One of our district councils says, yes, we want to be involved in that. We absolutely see what that can do. We're really excited about that. So it's by actually showing people what is the art of the possible, and doing it in a test and learn, which then manages, because we can be rather risk adverse in the public sector. So, but and having worked in central government, I see it from that perspective as well, and in the NHS. So doing it in this way enables us to take the risk, but not make it too big a risk and too big a step for people. But the important thing for me then is, how do we scale up and out? But we're also working in the context of our ICS, and so we've been key to developing a shared care record across organisations, and that's a thing that we're working on locally, because we see data as the key here. It has to be able to get those insights to then act and improve service delivery.
Fascinating. Sam Pittman-Smith, Director of Transformation at Norfolk County Council, thank you very much for talking to me.
No problem. Thank you. Been a pleasure for me too.